Good afternoon, everybody. I would like to welcome you all to this webinar entitled Inspire Change, Act on NCDs in the COVID-19 Era, jointly organised by the NCD Alliance and the Ecobank Group. My name is Dain. I'm the CEO of the NCD Alliance. It's a pleasure to be with you all today. And I see that people are still joining, so welcome from wherever you're joining from. We're really delighted to be able to host this webinar together today on the occasion of Ecobank Day, which is focusing on NCDs for 3 years, as well as ahead of the World Diabetes Day on the 14th of November. Let me start by expressing my gratitude to the Ecobank Group and Ecobank Foundation for their partnership on this important event, and for their leadership on focusing Ecobank Day on NCDs to raise awareness and mobilise employees and communities on this important health and sustainable development issue across the continent. For those of you who might not be familiar with us, the NCD Alliance is a global civil society network uniting some 2,000 organisations in more than 170 countries, dedicated to improving the prevention and control of non-communicable diseases. We're very pleased to have 95 members, 22 national NCD alliances and 2 regional alliances in Africa, who are all very active leading advocacy, raising awareness and providing essential services to people living with NCDs across the continent. For those of you who might not be so familiar with non-communicable diseases as a term, this includes diabetes, cardiovascular disease, chronic respiratory diseases, cancer, and mental and neurological disorders. And together, these diseases are the world's biggest killer and cause of disability, responsible for 71% of death globally, which represents over 41 million deaths every year. That's equivalent to 3 in every 4 deaths worldwide. 1/3 of deaths from NCDs are premature, which we refer to as occurring before the age of 70, really blighting family economies. But the vast majority are preventable and can be delayed. Projections forecasting the next 20 years shows that the NCD epidemic has only just begun. For diabetes alone, global prevalence is estimated to escalate from 463 million in 2019 to 700 million in 2045. This acceleration is largely a crisis of our own creation. Urbanisation, globalisation and economic development have drastically changed how we live, work and play, and in turn are increasing exposure to 5 shared risk factors: unhealthy diets, physical inactivity, tobacco use, harmful use of alcohol and air pollution. These risk factors cause over 2/3 of all new cases of NCDs. And with so many health challenges, it's just in the most vulnerable populations that are hit the hardest by these diseases. 4 in every 5 people living with non-communicable diseases live in low and middle income countries. And NCDs and injuries account for more than 1/3 of the burden of disease amongst the poorest people in the world. In sub-Saharan Africa specifically, there's been a real surge in the NCD burden over the last 2 decades. NCDs were responsible for 3.1 million deaths in the African region in 2015, according to WHO, set to become the leading cause of mortality in sub-Saharan Africa by 2030. And this is without even considering the impact of the COVID-19 pandemic, which is very much the context of today's webinar. In the context of the pandemic, there is now plenty of evidence on the intersections between NCDs and COVID-19. It's clear that both reinforce one another and disproportionately impact the vulnerable communities in every country. In Africa, the total number of people who've contracted the virus on the continent surpassed 1.3 million in September, with nearly 32,000 deaths. In the early stages of the COVID emergency, many political leaders in the media were talking about the vulnerability of people living with underlying medical conditions. But the vast majority of underlying medical conditions are essentially people living with NCDs. And in the African region, hypertension, diabetes, cardiovascular disease and asthma are the comorbidities most associated with COVID-19 patients. As we are all very familiar in living through this pandemic, COVID has placed unparalleled strains on health systems across the African continent, but globally in high-income and low-income countries alike, creating widespread disruptions to access to essential medicines for people living with diabetes and other NCDs, as well as blocking routine health services such as screening, treatment, and palliative care. Overall, COVID-19 has really exposed the damage that neglecting non-communicable diseases and cutting public spending on health, on prevention, on essential public health services has done over many years in many of our countries. And it's really crucial that the international community and governments alike really learn the hard lessons from COVID and build back better to protect their populations, to leave no one behind, and to invest in the things that matter: health and non-communicable diseases. This will really require a collaborative multi-sectoral response, which we mean involvement of governments, of multilateral agencies, of civil society and the private sector. And within this, community engagement and the efforts of civil society will also be even more critical to maintain political and media attention on the needs of vulnerable groups, to build trust, and to protect and support people who are at most at need. At the NCD Alliance, we're very proud to have seen a substantive growth of the global NCD community over the last decade, and including within the African continent. And we believe it's crucial to protect the progress made over the last years and to really support civil society platforms that are essential to the NCD response. And with that, I will now hand over to our expert moderator, to Kaushik Raman, who is the chair of the NCD Alliance over many years, since the very beginning, who will be taking us through the programme today. So let me pass it to Ryan to the session. Thank you.
Good afternoon, everyone, and thank you very much, Katie, for your introduction and your insight. I think you've raised a very important and important issues which we'll indeed be discussing over this period of today in greater depth, including the rise of diabetes in the African continent, inequalities to the healthcare, and the benefits of the people-centered approaches to the health system strengthening. As you have correctly illustrated, we have seen in Africa and around the world how COVID-19 pandemic has stretched the underfunded health systems all over the continent, and especially shining a spotlight on the failure of the health systems to cope up with these comorbidities. It has also called upon the global attention to another health crisis, which has been on many decades in the making, and that is of the increasing burden of the non-communicable disease. And when you have an uncontrolled non-communicable disease like diabetes or hypertension, how the comorbidities are affecting its morbidity and mortality. We know that people living with NCDs are at much higher risk of becoming severely ill when they get comorbidities such as COVID-19, and are likely to experience quite a significant obstacles to the health system approaches and health system responses to their comorbidities. With this background in mind, the NCD Alliance and the Ecobank Foundation have organized this webinar to convene the NCD leaders, champions, people living with NCDs, and advocates across African region to raise awareness of the scale, impact, and urgency of NCDs in Africa in the context of COVID-19. This webinar is taking place on the occasion of Ecobank Day, which has been held each year since 2013. As a Pan-African bank, Ecobank dedicates this day and many efforts throughout the rest of the year to a variety of causes in the local communities where Ecobank operates. This year, the key focus of Ecobank Day is placed on diabetes, which is becoming more and more prevalent throughout Africa, with cases of diabetes rising at an alarming rate. Ecobank Day activities will be centered around the prevention and care of this major NCD in coordination with the World Diabetes Day on 14th of November, which is the World Diabetes Day. So another objective of this webinar is to raise awareness on the vital role of the civil society engagement and community-led efforts in accelerating action from local to global levels and strengthening the political commitment on the urgency to invest into robust and resilient health systems. To do all this, we will discuss many lessons learned from COVID-19 and their implications to inform health policies with an emphasis on diabetes. We'll also explore how we can build back better together and how we can help to position investment in prevention as an essential foundation for human security and preparedness for the health emergencies. Finally, this event will also be an opportunity for the launch of the Turning the Tide mini documentary series in Africa, produced by BBC StoryWorks and the NCD Alliance, which will start out with just in a moment. First, I need to share that this webinar will be recorded and be made available on the NCD Alliance website. I'd also like to ask that everyone set their microphone to mute so that our background noises do not interrupt the panel. And if you see at the bottom of the screen, there's a translation service is available. So in case if you want to hear the webinar in French, then the translation is available. And for those French speaking or English speaking, alternate translations are available. Now it gives me a great pleasure to introduce BBC journalist, Mrs. Gemma Jennings, and I hand over to you, Mrs. Jennings, to proceed. Welcome.
Thank you so much. Hi all, and thank you for the opportunity to join you today. On behalf of the BBC, I'd like to say thank you to the NCD Alliance and Ecobank Group and Ecobank Foundation for inviting us to share with you a series we're extremely proud of. In February of this year, BBC StoryWorks launched Turning the Tide, a short documentary film project we hoped would place a much needed spotlight on the work of institutions around the world who are influencing dialogue and encouraging action within communities burdened by NCDs. When we set out with the NCD Alliance to create this series, we wanted to raise awareness of NCDs. We wanted to challenge some of the perceptions associated with these diseases and to highlight the incredible burden, both financially and socially, these diseases are having on communities. But more important than those things, we wanted to find a way to connect with audiences and for the series to have a positive outlook. Ultimately, this is a series about hope and about solutions. The narratives show the power of the NCD community. They show the way in which public-private alliances can build meaningful action, and we hope that they continue to inspire action. Now, in the face of an unprecedented global health challenge, it is more important than ever to share stories from the NCD communities, and events like today are crucial to the ongoing efforts of stakeholders across the world as we consider what is next for NCDs. Before we hand over to the panel discussion, it is my pleasure to play for you a short film from the series, which was created in collaboration with Cambridge University and the University of Yaoundé. As part of the development of Turning the Tide, we saw innovative solutions for the prevention and care of NCDs. One such solution was the Global Diet and Activity Research Group's work to equip students in Cameroon with the skills to become citizen scientists who will ultimately co-design their environments. This was a great film to work on, and we hope that you find it inspiring ahead of today's discussion. Thank you.
This is Yaoundé, a vibrant, growing city in Cameroon, undergoing rapid urbanization, which has incredible benefits, but also brings with it challenges, in particular, a rise in non-communicable diseases.
One generation ago, most of the diseases you'd find in hospitals would have been things like malaria, typhoid, or intestinal tract infections. Within this context of uncontrolled urbanization, people tend to be exposed to unhealthy diets, pollution, smoking. They become less physically active. All these factors would expose these people significantly to develop cardiovascular disease, diabetes, high blood pressure, cancers in their lives.
Rhedoor is a research partnership. It's funded by the NIHR. We focus on the societal determinants of non-communicable diseases, factors in the environment and in policy that impact on what people eat and how physically active they are. We also focus on designing and evaluating interventions to address those environmental determinants and address long-term health.
For me, I don't usually go and eat fast food. When my friend decide to go and eat fast food, I go with them. So many of them contain fat and it's not good for our health.
The trend of the increasing non-communicable disease epidemic is a very worrying one in terms of affordability. We know that the context of many countries in Africa, like Cameroon, is that the health system is already overburdened because we actually want to prevent that burden getting to the health system.
What we have been doing with adolescents in schools in Yaoundé, we are adopting what is called the citizen science approach. The individuals in the community themselves collaborate or cooperate with the researchers in terms of collecting information, analyzing this information, and making proposals.
We use an app that essentially allows these young people on their phones, so they capture their environment around their home, around their schools, and whether they see that as something that enables healthy behaviors or is a barrier to healthy behavior. By analyzing their own data, the aim is to increase their agency to effect change and to engage with implementers of policy, planning initiatives. Really, those tools give them the self-efficacy beyond their individual health into the wider population.
For these students, they actually feel ownership. They are the ones who would collect this data, analyze this data, interpret, and design the interventions. The community actually feels ownership. They know best what would work within their context.
We always think about NCDs within the context of how to diagnose, how to screen, how to treat. But moving from that to thinking about prevention being everybody's business is a huge disruption.
We hope that these interventions would be more sustainable in time because it belongs to the community in which it is applied.
We don't have the time to all learn from scratch every time. So it's really important that what is being learned and what is being understood in Cameroon, in Yaoundé, we share experiences with another city that is similar in those contexts.
I would like to express my gratitude to you all, especially community leaders, champions acting on non-communicable diseases, people living with NCDs, advocates across Africa, all Africans at home and in diaspora, as well as my fellow Ecobankers. A warm welcome to this seminar from Lomé, Togo. Today marks the 8th edition of our annual Ecobank Day, a day every year when we give back to our host communities across our wide footprint. 2020 has been a challenging year globally with the coronavirus pandemic, and this informed the virtual nature of our 2020 Ecobank Day. We committed last year to focus on non-communicable diseases for 3 years. This because NCDs are silent killers which incapacitate individuals, depleting our community of Africans' greatest assets, our human capital. Resources and attention to COVID-19 are already impacting both diagnosis and treatment of those suffering from NCDs. Pre-existing conditions, such as diabetes, hypertension, for example, increase the severity of COVID-19 for those who contract the virus. This results in additional stress on NCD patients in Africa, coupled with disruption in health services. According to the World Health Organization preliminary analysis as of September 2020, of 14 countries in the African region, hypertension, diabetes, cardiovascular diseases, and asthma are the comorbidities most associated with COVID-19 patients. Prevention indeed plays a critical role in averting the impact of some NCDs. Making personal choices to follow a healthy lifestyle to prevent and manage NCD is a good step to take. And I personally try to exercise daily by running at least 10 kilometers to stay healthy. I know that's not easy for everybody, but it's a choice we need to make. So why is Ecobank talking about lifestyle choices? At Ecobank, our purpose is Africa and NCDs are growing concern on the continent. We therefore not remaining silent on NCDs and aim to make a difference in our communities. Working with NCD Alliance on the Together for Better Health campaign, we are raising awareness and focusing on how to prevent NCDs. I must take this opportunity to express Ecobank's sincere gratitude to Dain, CEO NCD Alliance, and our team for guiding us in bringing our private public partnership to civil societies and organizations in Africa. Our Together for Better Health campaign started in 2019 when we led various walks across the continent, together with national authorities to ensure we raise awareness about NCDs, cancer specifically. We collaborated with government and civil societies to offer screening, counseling, and testing to the general public with focus on cervical and breast cancer. In kind and financial resources, we also provided to health facilities across the continent. A key part of the engagement has been about communities to continue to deliver services that advance the health and work. This year, we're inviting you to take action against diabetes as the world celebrates World Diabetes Day on Saturday, November 14. You will get a lot of data from the experts in this webinar on the importance for each of us to act and inspire change when it comes to diabetes and NCDs. As a banking group, we're contributing $100,000 from across our footprint to support NCD Solidarity Fund in order to empower the NCD Alliance in Africa in dealing with patients living with NCDs. This webinar is just the beginning of activities for our Ecobank 2020 Ecobank Day. My colleague, Carl Malam, the COO of Ecobank Foundation, will, during this webinar, provide more details of other activities in our various countries. Before I give the way to experts, I would like to thank all those behind the scene who helped to facilitate this event at Ecobank, at Ecobank Foundation, and of course, our partner, NCD Alliance. Many thanks to all participants for taking time to attend this webinar. Together, we can make a difference. Together for better health across Africa. Thank you.
Thank you very much, Mr. Ayeyemi, and we sincerely appreciate the support of the Ecobank for this great initiative, and I'm sure it is going to help the continent. It is going to help with the dissemination of the information and knowledge to the region. So once again, accept our sincere appreciation for your support to the NCD Alliance and to the African region. We'll now begin our first panel discussion, which will provide context on the challenges which have been presented by COVID-19 pandemic in the NCD responses in the African region. For this discussion, I'll ask one question to each of our panelists, starting with Professor Jean-Marie Dangou. Professor Dangou, as a coordinator of the NCD management program for WHO Afro, you are also on the front line in response to the COVID-19 pandemic. Given the many intersections of NCDs and COVID-19, what are the main gaps which have been revealed by this pandemic for the health systems which are already struggling in the region? And what are the main lessons learned for the African region in terms of the leadership? What demand has WHO Afro seen from the governments for the technical support, including national COVID-19 response, and how NCDs could be prioritized and invested in going forward? We welcome Professor Dangou.
Thank you very much, Professor Kaushik, the moderator of this session today. First of all, I would like to thank Ecobank Foundation and NCD Alliance for inviting the WHO, the World Health Organization, to this very important webinar. I'm pleased to join you today to explore how we build back better together and position investments in NCDs, prevention and control, as an essential foundation of health systems. I would like to appreciate the importance of the event and acknowledge other panelists. Before the COVID-19 pandemic, NCDs and injuries were impacting early mortality and disability in the WHO African region, which is composed of 47 member states in Africa. This was a significant challenge, particularly among socioeconomic disadvantaged population groups who often are at an elevated risk of NCD's risk factors. Poorer populations cannot access NCD care and remain without access to preventive and curative health services, either because health facilities are lacking, the services are lacking, or because they lack financial means to access services, leading to avoidable health inequities. Rural areas particularly are lacking decentralized care, and this is one of the biggest barriers to achieve universal health coverage. Since the beginning of the COVID-19 pandemic early this year, the pandemic has reduced health system performance with compromised capacity. We experienced overstretch and loss of health workforce, increased patient load, shortage of supplies, diversion of resources, change of priorities, and overstretched infrastructures. Consequently, there is a reduced availability and readiness of essential health services, particularly for NCDs, limited access to services, and interrupted programs implementations. In addition, the COVID-19 response is impacting NCDs' essential services, including NCD diagnosis and treatment, which are among the most frequently disrupted health services. In a rapid survey conducted by WHO in April and May this year, 41 participating countries in the African region reported disruptions of NCD services. This is concerning because people living with NCD, like diabetes and hypertension, are at greater risk of severe illness and death when infected with COVID-19. Furthermore, the COVID-19 imposed on us an unpredictable financial flow, as well as a challenging environment to deliver timely support to countries due to challenging political context in some countries, coupled with lockdowns and border closures. WHO had to adapt to the COVID-19 situation, including streamlining the role of country offices, provision of remote support to national programs, and outsourcing of some functions to technical experts within countries. These adaptations were based on interim lessons of the COVID-19 response, including the need for in-country institutions with capacity to provide sustainable technical support to national health systems, especially for disease control, national health services that are agile, resilient, and autonomously scalable or adaptive for better coherence and alignment between routine health delivery services and health emergency infrastructure. The revamp of primary health care preparatory for the next pandemic, shift from basic service to essential services, a rethinking of what services are needed to each level of the health system, but also good and comprehensive health intelligence system, a move away from traditional focus on data to building information system. And last, investment in digital technology and consideration for use of digital technology to fill gaps in provision of essential services, as well as an adjunct to strengthening health system. The COVID-19 pandemic has reaffirmed the importance of everyone having access to needed quality health care that they can afford. However, in African countries, although NCDs may be part of essential packages of services, often payments for medication and treatments are made out of pocket. This means, particularly for low-income households, that NCD services are often out of reach. Countries are asking for urgent guidance and support from WHO, guidance on how to provide continuity for NCD programs, risk communication materials, better data, technical assistance to implement integrated management of NCD using the primary healthcare approach. What could be done next to build back better? First, ensure seats for people living with NCDs at the decision table. Establish new approaches to prevent crises for people living with NCDs during disease outbreaks. Build a stronger response of unity and solidarity to include NCD services in primary health care in all countries and build a safer, more stable future. Demonstrate courage and determination to expand benefit packages for universal health coverage to include non-communicable diseases, extend existing domestic fiscal measure and global financing instruments to all African countries that request support to include NCD into primary health care and universal health coverage, conduct constructive dialogues and partnerships with the civil society and the private sector on meaningful, effective, and joint efforts. And this webinar is a demonstration of that. Tell the world regularly how many people have NCDs, how many are aware of the status, how many are on treatment. Finally, as we recover and rebuild, digital technology will be more prominent and important than ever. Thank you very much. Kaushik, you are muted.
Okay. Thank you very much, Professor, for your setting the stage and highlighting the WHO Afro response to the health system and how you are able to assist the countries within the African region to cope with this COVID-19 and diabetes or non-communicable disease comorbidities. Now, my next question is for Professor Jacko Abodo. Professor Abodo, you have been advocating on NCD prevention and control to be prioritized for some time, including through your role as an NCD Alliance head at Cote d'Ivoire, as well as the chair-elect for the IDF Africa region. And you must be looking at this impact caused by the COVID-19 on the NCD community with frustration. In your opinion, has the pandemic of COVID-19 been a light bulb moment for public and political mobilization and perception of importance of tackling diabetes and NCD and investing in prevention as a part of the national COVID-19 response? And how do you think the civil society efforts can help catalyze action on NCDs in Cote d'Ivoire, for instance, and across Africa more broadly, since you represent both the NCD Alliance as well as IDF Africa region? You're welcome, Professor Abodo.
Merci, professeur Kaushik. Je suis très heureux de vous voir et je salue tout le monde et toute l'équipe de NCD Alliance et nos partenaires de Ecobank. Alors, comme vous le suboderez, ça a été au début très difficile pour les pays africains en général et également pour un pays d'Afrique de l'Ouest comme la Côte d'Ivoire, qui sont en général des pays à ressources limitées. Et l'épidémie a été donc déclenchée en Chine en décembre 2019 et ce n'est que tardivement, notamment en mars, véritablement que les ripostes ont commencé à se mettre en place dans la plupart des pays africains. Donc, c'est l'occasion de revoir, si cela est possible, le règlement sanitaire international pour les alertes en cas de pandémie aussi grave, parce que la plupart, je l'ai dit, 95% des cas de COVID-19 dans nos pays africains ont été des cas importés. Alors que si le règlement sanitaire international qui a été mis en place en 2005 avait été revu et adapté, je pense que l'alerte aurait été rapide d'une part, mais deuxièmement, les systèmes aéroportuaires de la plupart des pays africains auraient pris les dispositions afin de limiter au mieux l'arrivée des cas importés de la plupart des pays africains. Alors donc, le premier cas en Côte d'Ivoire, c'était le 11 mars. Il s'agissait d'un patient ivoirien, mais qui vivait en Italie et qui a pu passer les mailles donc, de l'entrée et qui a pu secondairement propager l'infection. Et très rapidement, l'épidémie s'est déployée sur l'ensemble du territoire, en commençant bien entendu par le Grand Abidjan et a envahi progressivement les villes de l'intérieur, les provinces. Le gouvernement a été prompt à réagir en fermant les frontières, en organisant le couvre-feu, limitant les déplacements. Donc, d'abord, confinement partiel, vous connaissez les difficultés financières et économiques de nos pays africains. Confinement partiel, ensuite, confinement quasi total, notamment pour les sujets atteints de diabète et de maladies chroniques. Alors, malgré cela, les cas ont augmenté et très rapidement, nous avons dépassé pratiquement les plus de 20 000 cas aujourd'hui. Donc, en 8 mois de cette pandémie, nous avons enregistré plus de 20 700 cas de COVID-19, parmi lesquels plus de 75% étaient des sujets atteints de maladies chroniques, à savoir des diabétiques, des cancéreux, des hypertendus et des sujets atteints d'insuffisance rénale, des maladies respiratoires et également des sujets obèses. Heureusement que nous avons cependant des centres de prise en charge assez expérimentés. Il s'agit notamment du service de maladies infectieuses qui a pu circonscrire ces cas d'atteinte et donc les cas de décès. Et nous avons enregistré 129 cas de décès et parmi eux, 60 cas de sujets atteints de diabète et puis près de 30 à 40 cas de sujets atteints d'autres maladies chroniques. Donc cela veut dire que l'inaction est un problème, mais la prévention doit surtout être capitale. Alors, en ce qui concerne maintenant les possibilités de limitation de ces cas de catastrophe ou de ces cas d'épidémie, de pandémie dans nos pays africains, il faut prendre les mesures de prévention urgentes. Et les premières mesures de prévention, il s'agit de la sensibilisation et du dépistage du grand public. Accentuer cette sensibilisation dans les populations, mais surtout dans les familles. On connaît l'hérédité des maladies chroniques. Si le dépistage et la sensibilisation, la prise en charge est faite au niveau déjà du cercle familial, cela va bien entendu réagir à tous les niveaux. Et donc, deuxième point, ce sont les leçons que nous pouvons également en tirer par rapport à ces possibilités pour l'avenir là. C'est de dire que, compte tenu du fait que la plupart des pays africains n'ont pas la couverture maladie universelle, il est donc important d'associer les possibilités de médecine traditionnelle à cette médecine de ville, à cette médecine développée. Et donc, prévoir également des centres de référence. Ces centres de référence-là pourront prendre en charge les cas les plus graves et éventuellement une collaboration entre pays africains, donc collaboration sud-sud pour une meilleure prise en charge des cas. En tout état de cause, en ce qui concerne le diabète, nous, en Côte d'Ivoire, après la mise en place de l'Alliance des maladies chroniques, nous avons essayé de faire un focus point sur le diabète gestationnel. Parce qu'en agissant sur le diabète gestationnel, on peut réduire l'incidence du diabète, mais on peut également réduire la mortalité maternelle et infantile. La réduction de la mortalité maternelle et infantile permet bien entendu de diminuer l'indice de mortalité de la plupart des pays africains. En ce qui concerne par contre les autres maladies infectieuses, notamment les cancers, les centres de radiothérapie sont extrêmement importants dans les pays africains et également la chimiothérapie. Donc, d'où l'intérêt de la possibilité de mettre en place ce qu'on appelle l'utilisation des médicaments génériques à coût réduit pour que la plupart des populations puissent bénéficier de ces soins. En ce qui concerne les maladies cardiovasculaires, les maladies rénales et les autres maladies chroniques, nous le savons tous, il faut agir surtout sur les facteurs de risque qui sont communs, à savoir réduire la consommation, sinon arrêter la consommation de tabac, réduire la consommation d'alcool, avoir une alimentation saine et équilibrée et avoir une activité physique régulière. Voici en quelque sorte, de façon succincte, l'apport des alliances des maladies chroniques, notamment des alliances diabète, des alliances cancer et des alliances des autres maladies chroniques qui peuvent apporter à nos gouvernements en toute responsabilité, en toute efficacité, en intégrant surtout les sujets atteints de maladies chroniques, pouvoir faire porter la voix et que les gouvernants puissent prendre en compte ces aspects-là et éviter les catastrophes en cas d'épidémie, comme cela a été le cas à l'occasion de cette pandémie à COVID-19. Je vous remercie.
Thank you very much, Professor Abodo. I think you highlighted the challenges which the country has faced, the mitigations which has been done, the role of the traditional medicine and the other medicines, the conventional medicine, and what could be done, and what could be the preventive measures which could be done. Now, my last question for panel one is for George Kwayu. George Kwayu is a person living with type 1 diabetes and is the chairman of the Tanzania Diabetes Youth Alliance. And he has also faced quite a number of challenges with COVID-19 pandemic. And I'm sure, based on his own experience of the mitigation which he had to do in order to access care, would be an excellent experience to gain from George Kwayu. So George Kwayu, you are welcome to give your experience of what you have had during the COVID-19 crisis.
Thank you so much, Professor Kaushik, for this opportunity, and also thank you so much to NCD Alliance and Ecobank for this opportunity to just highlight the issue of the COVID here in Tanzania, how the people with NCD and diabetes, how they just affected with the COVID. From my side, I'm representing the youth who have type 1 diabetes here in Tanzania. Many youth who have type 1 diabetes just go through the challenge of getting insulin. For example, because of this COVID happened, so many distributors for the insulin in Tanzania here, so they are not getting the insulin due to their pharmacy. For example, yesterday I just get some details from the Novo and also Salama Pharmacy. They say they can't get the insulin because of the issue of the COVID, so they're supposed to give them the details because there is COVID in Europe, and they can't produce the insulin due to the short of workers in the company, and also they're supposed to give them the details or to order the 8 months before. So you can see for us, for the people who have type 1 diabetes here, we can't live without the insulin, and also the African countries, they don't have the industry which is producing insulin. So it's becoming the really difficult time for the people who have type 1 diabetes, especially here in Tanzania, to get the access of insulin on time. And now you can see some other pharmacy also, they're not getting insulin, you know, and also it just affects us a lot. What I can say to NCD Alliance and Ecobank, it is how they can just help us, the African countries, how they can make the ways, or they can just prepare the initiatives, how we can just getting the insulin for the young people and children who have type 1 diabetes here in Africa, because this time of COVID, and also there is another now explosion again of COVID is continuous. So it's just gonna even affect us more if we are not gonna getting the way of getting those insulin here in Africa. So that is my just view for now, and that is my point. Thank you.
So thank you very much, George, based on your experience. And while we are starting to discuss on these panel discussions, I have some questions. We have received some question on the chat box, and I'll be directing it to the individual panelists while we continue with the discussions. The first question is, how can we help shape the policies for African governments to tackle these diseases earlier? And this definitely will go to Professor Dangou. And also, second question to Professor Dangou would be, what are his views on qualified human health resources, taking example of cancers, where diagnosis is an essential element of prevention, and how is that the examinations are generally sent to France for the investigations or for any further management? This could probably be related to the French-speaking countries of the region. But two most important questions are, how can we shape the policies for African governments to tackle this disease? And what would be the human resources? And what are the inputs required within the human resources to ensure that we have a better response? So, Professor Dangou, would you like to take those questions?
Thank you. Thank you very much, Professor Kaushik, our dear moderator. Allow me to respond to these two questions in French, as interpretation is provided, so all participants could now go to the language they prefer.
Yeah, you're welcome.
Thank you very much. Pour parler maintenant de l'engagement des gouvernements africains à la lutte contre les maladies non transmissibles, il faut savoir que depuis plus d'une décennie maintenant, il y a un momentum au niveau mondial pour la lutte contre les maladies non transmissibles et plusieurs documents d'orientation politique ont été signés par nos gouvernants, les gouvernants des pays africains. Au-delà de ces documents mondiaux signés, qu'il s'agisse des documents qui avaient été proposés par le secrétariat général des Nations Unies, par l'Assemblée mondiale de la santé, par des organisations internationales comme NCD Alliance, UICC et j'en passe, il y a eu des documents d'orientation politique avec des engagements fermes de nos gouvernants, signés aussi au niveau régional, et qui plus est, ont aussi été adaptés et adoptés au contexte des pays. Donc, nos gouvernants, en matière d'engagement, ont signé suffisamment d'engagements. Là où le bas blesse, c'est que ces engagements ne se traduisent pas en termes réels par des interventions sur le terrain. Les interventions ne sont pas pleinement menées et un fort impact obtenu, soi-disant parce que les ressources financières sont insuffisantes. Aujourd'hui, notre plaidoyer réside dans l'augmentation des ressources nationales allouées à la prévention et au contrôle des maladies non transmissibles, en plus de l'appui technique pour la mise en œuvre, le suivi et l'évaluation de ces interventions. Voilà ce que je voulais dire pour la première question. S'agissant de la deuxième question, qui découle directement de la première, pendant de nombreuses années, les systèmes de santé et les structures de formation en santé dans nos pays se sont focalisés sur les maladies transmissibles, les maladies de la mère et de l'enfant, les désordres nutritionnels. Ce qui fait que plusieurs personnes ont été formées dans ces différents domaines et aujourd'hui assure la mise en œuvre dans les pays. On pensait, il y a encore quelques dizaines d'années, que les maladies non transmissibles n'existaient pas dans les pays africains parce que c'était des maladies de l'opulence, des maladies de luxe, etc. Ce qui est complètement faux. On assiste à une transition épidémiologique nette avec déjà beaucoup de personnes qui perdent la vie dues aux maladies non transmissibles. Certains pays ont réadapté leur système de formation à cela et plusieurs collègues sont formés aussi bien à la gestion sur le terrain des maladies non transmissibles, diagnostic, prévention, réhabilitation, etc., que des collègues formés à la gestion administrative, à la gestion politique des maladies non transmissibles. Mais cela est encore très, très insuffisant et donc il faut renforcer. Malheureusement, le problème de financement se pose et tous les pays ne peuvent pas avoir leur structure de formation pour un certain niveau de personnel de santé. Ce que nous avons proposé alors, c'est d'avoir des centres d'excellence qui sont communs à plusieurs pays et pour le moment, de focaliser sur la formation du personnel paramédical, y compris les agents de santé communautaires, pour plus d'équité, afin qu'on décentralise la lutte contre les maladies non transmissibles au niveau des soins de santé primaires, déjà, et que les hôpitaux du district et les hôpitaux nationaux soient renforcés parallèlement. Voilà un peu la réponse que je voudrais apporter à ces deux questions. Merci, monsieur le modérateur.
Thank you very much, Professor Dangou, for that response. Basically, I think you raised two issues. One is utilization of the existing tools and the documents which are there within the WHO AFRO for mitigating the comorbidities and for mitigating and improving the health systems. And two, the challenges of the health, human resources for health. And most importantly, the component of training of human resources for health and the task shifting at the low levels of care, because majority of our population within the region live within the rural areas where their access to primary care is crucial. And if you look at the scenario of the NCD care, then you find that at primary care, there is hardly anything which is actually effective, and we need to really strengthen those primary care if we are to really cope up with this type of pandemics or comorbidities, which are usually increase the burden on the health services. George, you mentioned regarding access to insulin for people with type 1 diabetes, whereby insulin is life-saving. And you mentioned about the challenges you had with the importation of insulin in some of the countries in the African region, taking Tanzania as one of the examples, whereby suddenly some of the insulins disappeared from the market because the supply system was not able to basically cope up. At the same time, importation became a challenge because of the lockouts. So what was the innovations you did for your members within the type 1 diabetes community of how to tackle this component of having no insulin or insulin which is not the one which you use? Probably you got a short acting, long acting. What were the issues you were using? Yeah.
Professor Kaushik?
Yes.
Alors, I just have failed my connection. Can you repeat, please?
Yeah, I was asking George and I was asking you, Professor Abodo, that there has been a major challenge of getting insulin for people with type 1 diabetes because of this COVID-19, and there has been supply chain interruptions. And as an IDF Africa region and as an NCD Alliance in Ivory Coast, what has been the mitigation efforts which have been done by yourself as an IDF Africa region? Or I was asking George as a type 1 diabetes, Tanzania Diabetes Youth Alliance, what are the mitigations they've done?
Merci, professeur Kaushik, pour cette question. En effet, nous avons pris toutes les dispositions de vérification au niveau de la Côte d'Ivoire des différents stocks en insuline dans toutes les pharmacies. Et nous avons eu écho des difficultés d'approvisionnement qui allaient survenir dans les mois à venir. Et nous avons, dans ce contexte, informé tous les patients diabétiques. Il y en a qui ont eu l'occasion de faire des stocks en interne, mais nous avons veillé surtout à ce que ces mises en stock ne soient pas déséquilibrées. Finalement, quand on a fait le bilan, on s'est rendu compte qu'il n'y a pas véritablement eu de rupture dans la livraison d'insuline. Cette rupture a duré tout au plus 1 mois et n'a pas du tout impacté l'approvisionnement des patients diabétiques, notamment diabétiques de type 1, qui bénéficient d'une gratuité de prise en charge avec le projet CDIC subventionné par le laboratoire Novo Nordisk. Donc, on n'a pas véritablement eu cette difficulté d'approvisionnement en médicaments, en insuline et en médicaments en général pour les sujets atteints de maladies chroniques. Cela n'est pas véritablement survenu en Côte d'Ivoire. Est-ce que je me fais comprendre?
Okay, George, would you like to? Yes, we did understand. George, can you answer that question? Because knowing in Tanzania, we had this program for Life for a Child, and we have changing diabetes in children where the supply chain was intact. What happened for those who are outside the supply chain?
Professor Kaushik, and also you are doing also the follow-ups of this supply chain for the insulin through the medical store department, the MSD in Tanzania. So due also to this issue have happened to the COVID, there is some issue even between the medical store department on supply of insulin in Tanzania. For example, the insulin who come from change diabetes in children, CDIC, and also the insulin come from Life for the Child program. So sometimes I'm just get some feedback from these different clinics, because we in Tanzania we have 36 clinics all over the country for the type 1 diabetes. So sometimes, because we have the WhatsApp group which have more than 190 youth and children with type 1 diabetes, also with their responsible parents, doctors. And now, so I'm just getting some feedback. So there are some clinics, there is no availability of insulin, but also sometimes they go in the out of stock in the clinics. Sorry. So when you contact also the people from the medical store department, they say, there is issue of transport those insulin, and there is a lot of things is going on. So sometimes, so the people back to me and say, George, what is going on? How there is no availability of insulin. So I used to say, okay, I'm doing the follow-up. So I'm trying also sometime, like the last week, I contact the NCDA project manager, happy to asking her about what is going on about insulin, because there is some clinics, there is no availability of insulin, and she says also she'll do the follow-up with MSD. Also, there is some issues in CDIC because we go to the medical store department to asking them there is insulin come through the donation, and what is going on, because we're never getting any feedback from those people. So there is a lot also, Dr. Professor Kaushik, I think you know about it, and you are working on it. Yeah.
Okay, all right.
Yeah.
So in short, I think the issue is internal, and the second thing is that it could be external, but at the same time, if I was to end this discussion, Professor Dangou, being at the WHO, taking into consideration the COVID-19 pandemic which we had, if you were to plan for the next 5 years in one sentence, could you tell us what would be planning differently for the African region, taking into consideration the challenges we have with the health systems?
Thank you very much, Professor Kaushik. In one sentence, I will promote and insist on the decentralization of services at primary healthcare level. So we will be implementing preventive, curative, and rehabilitation measures for NCDs at primary healthcare. Back to you.
Thank you very much, Professor, for that answer. And I think it summarizes our major challenge is to get the NCD care at the primary care where the majority of our population lives, and that is what we need to strengthen. I would now like to thank the first panelist for an excellent presentations and excellent discussions, and I would like to go to the second panelist session. And this second panel will focus on explaining solutions to mobilize the communities in the African region for a people-centered response to NCDs in COVID-19 crisis. I will follow the same format as the first panel, and my first question goes to Mrs. Aminatou Sarr from PATH. They are based in Senegal, and they have been responding proactively to COVID-19 pandemic through its country work and leveraging one of its key pillars of work focused on the community empowerment. In Senegal, in addition to your program activities, PATH is now also supporting the Secretariat of the nascent NCD Alliance in Senegal. Can you tell us more about how the communities have been affected in Senegal by the COVID-19 pandemic and what PATH has done to mitigate that effect, in addition to adapting its operations in Senegal to support communities which have been affected by these NCDs in a multi-sectoral approach where the government, the private sector, and the civil society have joined hands together?
Merci beaucoup. Merci, professeur Kaushik. Je voudrais d'abord remercier l'Alliance NCD et la Fondation Ecobank de nous avoir associés à cette importante discussion. Comme vous le savez, le Sénégal faisait partie des premiers pays en Afrique subsaharienne à avoir été touché par la COVID. Et je pense que, à part le fait que le gouvernement, en prenant une approche multisectorielle, en incluant pas seulement le ministère de la Santé, mais aussi en amenant le ministère des Finances, le ministère de l'Intérieur et d'autres importants ministères, a pu mettre en place très rapidement un comité national de gestion de l'épidémie qui a permis aujourd'hui à ce que le Sénégal soit cité comme un exemple de gestion de la COVID. Après le succès qu'on a eu au Sénégal, je pense très sincèrement que ça a été un succès qu'on peut attribuer à la population, aux communautés. Comment très vite des individus ont pu mobiliser des communautés dans leur localité pour faire des masques. En ce temps-là, il y avait toute la crise des masques dans beaucoup de pays. Des masques en tissu, en utilisant le wax, en utilisant nos tissus locaux pour déjà commencer à sensibiliser les gens qu'il faut se protéger du virus. Ça a été quelque chose de très important. Comment la COVID a touché les communautés? C'est que les personnes qui forment la communauté se sont retrouvées avec leur maladie chronique. Beaucoup, malheureusement, des personnes que nous avons perdues au Sénégal avaient des comorbidités qui étaient des maladies chroniques, des maladies non transmissibles. Et ça a été, pour moi, un des plus gros impacts qu'il y a eu dans les communautés, c'est que dès les premiers jours, la communication était autour du fait que si vous avez de la fièvre, si vous êtes malade, n'allez surtout pas dans les structures de santé. Appelez un numéro, quelqu'un va venir vous faire un test. Ça a été, de notre point de vue, très dévastateur, ce genre de message-là, parce que ceux qui souffraient de maladies chroniques, ceux qui avaient des rendez-vous dans les hôpitaux, ceux qui ont eu des fièvres palustres n'ont pas osé aller dans les structures de santé. Et malheureusement, c'est peut-être ces personnes-là qui ont payé le plus lourd tribut. Je connais personnellement une dame au Mali qui avait un diabète, qui avait un rendez-vous, elle vivait à Caille, avait un rendez-vous à Bamako, n'a pas osé aller à son rendez-vous à cause de la situation Covid. Quand finalement elle s'est sentie très très mal, elle est allée, c'était trop tard, son état s'est aggravé dans la journée et elle a malheureusement perdu la vie dans la journée. Ce qui veut dire qu'en vérité, quand on répond à une pandémie et que la conséquence de cette réponse, c'est de voir les autres maladies prendre un lourd tribut, c'est qu'on a mal répondu à la pandémie. Si aujourd'hui on dit qu'on a réussi à répondre à la COVID et qu'à la fin de cette pandémie, on voit toutes les avancées que nous avons faites sur les maladies non transmissibles, sur les maladies tropicales négligées, sur le paludisme, sur la nutrition, sur toutes les autres maladies qui continuent, toutes les autres problématiques sanitaires qui se posent à nous. Si à la fin de la réponse à la pandémie, on voit tous les efforts qui étaient faits retomber, ça veut dire qu'on aura mal répondu finalement à cette pandémie-là. C'est pour ça que nous, à PAS, très tôt, on a compris que faire les choses comme on le faisait avant n'était pas une option. Je donne un exemple concret de notre travail qu'on faisait dans la région de Tambacounda pour le paludisme. Quand la COVID est arrivée, on venait de lancer un important programme de mobilisation des communautés dans la gestion du paludisme avec un pool de champions communautaires qui ont été mobilisés pour sensibiliser sur le paludisme parce que la saison des pluies allait commencer. Et Tambacounda, qui est au sud-est du Sénégal, est une des régions les plus touchées par le paludisme. Ces champions communautaires commençaient à peine à faire ce travail de sensibilisation dans les communautés quand la COVID est arrivée. Et c'est là que nous avons pensé à former ces champions communautaires sur la COVID. Qu'est-ce que la COVID? Qu'est-ce que la communauté peut faire pour se protéger contre la COVID? Et surtout, comment on peut amener les communautés à retourner vers les structures de santé, notamment les personnes qui souffraient de maladies chroniques, les femmes enceintes qui doivent continuer à faire leur visite prénatale, les enfants qui doivent continuer à être vaccinés. Il était très important qu'on puisse faire cette rhétorique-là sur oui, on doit se protéger contre la COVID. Oui, on doit éviter les rassemblements. Oui, on doit soulager les structures de santé. Mais non, on ne reste pas à sa maison quand on est malade, quand on se sent mal, parce que les meilleurs soins qu'on peut avoir, c'est dans les structures de santé qu'on peut l'avoir. Donc, voici un exemple des choses que nous avons faites en mobilisant donc ces champions communautaires qui ont fait des visites à domicile, qui ont pu approcher les leaders d'opinion, des familles, des jeunes pour leur dire déjà la réalité de la COVID, mais aussi les inciter à retourner dans les structures. Nous nous sommes amusés avec les chiffres parce que vous connaissez peut-être pas le travail de PAS, on travaille beaucoup sur les données, sur l'analyse, la collecte des données, les investigations sur les données. Et ce que nous avons fait sur les données, c'est de faire superposer les structures sanitaires où il y avait le plus de cas de COVID et le taux de fréquentation de ces structures sanitaires. Et nous avons vu dans certaines structures une chute de près de 80% de la fréquentation. Ça a été quelque chose de très dramatique. Les communautés ont été affectées de plusieurs façons. La façon, évidemment, dans leur santé, mais aussi économiquement.
Madame, you have 1 minute, please.
Économiquement, les communautés ont été affectées. C'est dans ce sens-là que nous pensons que la prévention, elle est importante. Aujourd'hui, PAS assure le secrétariat de l'Alliance sur les maladies non transmissibles au Sénégal et ça regroupe toutes les associations de patients, que ce soit les diabétiques, que ce soit pour le cancer, les hémophiles, ceux qui sont des insuffisants rénaux, les associations aussi de professionnels de la santé publique. Et à côté de cela, nous allons aussi incorporer les structures professionnelles, les entreprises qui étaient impliqués dans une grosse campagne, dans un gros projet qu'on avait fait de sensibilisation et de prévention sur l'hypertension pour venir rejoindre cette alliance sénégalaise. Elle est naissante, comme vous l'avez dit, mais nous estimons qu'il est très, très important que toutes les forces vives qui luttent contre les maladies non transmissibles se mettent à travailler et à se concentrer les efforts sur la prévention, parce que nous sommes persuadés, et tout le monde est persuadé, qu'il coûtera moins cher à nos structures de santé d'investir dans la prévention, à nos entreprises d'investir dans la prévention que d'investir dans la prise en charge et le traitement des malades du diabète, des cancéreux, des malades du cœur.
Thank you very much, madam.
Merci beaucoup.
Thank you. And I go to my next panelist, and that is Professor Sani Malami from Nigeria, NCD Alliance. Nigeria NCD Alliance has been doing wonderful activities looking at the community sensitization, raising the awareness of NCDs, and actually has been doing a tremendous amount of work in Nigeria. Professor Malami, could you explain to us what has been done pre and post-pandemic, and what are the lessons you have learned from this pre and post-pandemic sensitizations which you have done as a Nigerian NCD Alliance, and what would be your message to the other colleagues in the African region and other NCD alliances within the region, and what are the main important lessons learned? You have 5 minutes, please. Thank you.
Thank you very much, Professor Kaushik, for the opportunity to join this conversation. Welcome this opportunity very much, and I want to sincerely thank the NCD Alliance and Ecobank for the invitation. The NCD Alliance Nigeria, which has been in existence since 2011, is a growing membership organization. And today we have close to 100 civil society organizations cutting across various disease entities, including mental health and specific to our own part of the world, of course, sickle cell disease. It's been a matter of great concern to us that particularly people living with NCDs are more vulnerable to the COVID-19, and this is the point that has already been highlighted this afternoon. And also it's a matter of great concern to us that in those communities where the COVID-19 pandemic had really taken hold, it seems to affect the vulnerable and the poorest in the communities more than any other part of the community. So beginning from March 2020, which is about the time that the first index case of COVID-19 was detected in Nigeria, our organization swung into action. Our initial strategy revolved around increasing awareness and also through advocacy and communication activities and mobilizing the community in particular. One of the activities that was very successful was, of course, a well-attended media event in which was a collaborative effort between us and other organizations in Nigeria, the media and government officials as well. And this was served to give opportunity for many Nigerians to have first information about the extent of the COVID-19 risks, and also how there's this intersection between the COVID-19 epidemic and there's the existing pandemic, COVID-19 pandemic, and the existing NCDs in Nigeria. Secondly, our strategy was to give a stronger voice to people living with NCDs in this fight. And we were lucky to have received a grant from NCD Alliance in this regard. And we mapped the people living with NCDs. We developed a database, and it was using this database of people living with NCDs that we organized 2 meetings with them. During those meetings, they were empowered and supported with new knowledge and skills. Lead champions were identified among them to drive the advocacy effort, and so on and so forth. Then stepping down from the national level to the sub-national level, our members were engaged at various levels, at various fora, with government officials, with lawmakers, with community leaders in the task forces for COVID-19. And it was through this mechanism that so much valuable scientific and professional knowledge was shared with them. And this was very important and significant in the Nigerian response to COVID-19. Again, we supported the people living on NCDs to establish a platform that was used to disseminate resources through Twitter, to Instagram, through WhatsApp and Facebook. Furthermore, the NCD Alliance Nigeria organized a workshop that developed advocacy and communication materials that targeted government officials, lawmakers, and community leaders. The most important lesson we've learned with the current pandemic is that the importance of engaging the community, grassroots mobilization. This is key to the successes that have been recorded in Nigeria, and we are very proud to have been part of this process. In addition to that, also they need to have a voice, to give a voice to the people who know. It's been very educative to listen to the people living with NCDs in Nigeria. Each one has an individual story, which is different. And they were key to the success of the dissemination of the information that took place. They were key to some of the policies. And of course, then most importantly as well, we as an alliance were also part of the task forces, as I said earlier, and these were important in mobilizing resources for not just COVID, but also the whole spectrum of the response across the board in Nigeria. So in summary, I would say that through various activities and collaborations, the NCD Alliance Nigeria significantly uplifted and amplified the community engagement before and during the recent COVID-19 pandemic. Thank you.
Thank you very much, Professor Malami, for that very specific message and experience you have gained by the community sensitization. Now, I would like to ask our last panelist on this panel, Dr. Tolu Oni from Cambridge University. Dr. Tolu Oni is a public health physician and urban epidemiologist, and we have seen in the movie when we started, in the documentary we just started when we started this panel discussion, that she has been working on research projects in Africa, looking at creative strategies to address the complex health issues faced by the vulnerable population, including addressing social and commercial determinants of health as a part of this pandemic response. So Dr. Oni, reflecting on the past and the present, and what are your wishes for responses to this pandemic that could also help save lives for people living with NCDs and prioritize the needs of the vulnerable population? The floor is yours, Dr. Oni.
Thank you, moderator, and thanks to the organizers for this invitation and for putting together this excellent event. I'd like to share three wishes and reflections from my perspective on NCD prevention. But before I do, I just want to make two points. Just thinking about what has been said so far. The first is around prevention and the fact that we really need to internalize more the preventable nature of the majority of non-communicable diseases that we're talking about. And that in Africa, this is even more urgent, where we have these under-resourced healthcare systems that are really already creaking under the existing burden of disease. So undoubtedly, we need greater and more significant investment in healthcare. At the same time, we also know that in the context of preventable diseases, the majority of factors, so over 80% of factors that influence health lie outside of the healthcare sector. And that there is no possible really feasible economic scenario where we're talking about economic growth and investment in healthcare that would future-proof the health system against this rising burden of disease. So really, the urgency of prevention cannot be overstated to really reduce the true baseline need for healthcare, and that prevention doesn't come after the treatment, because we know prevention is important, but we always in reality feels like, oh, we just need to tackle these more urgent short-term issues and then deal with prevention. But actually what we do today influences the health of tomorrow. And then the second reflection was on awareness, because we've heard some really great examples from different NCD Alliance on increasing awareness. Just want to reflect on the fact that the translating awareness to change requires denormalizing of unhealthy environments. So for example, when we talk about diabetes prevention, we know that this requires healthy eating, we know that, and physical activity, but how safe and accessible are these conducive environments? Is it normal that when we talk about air pollution, across Africa, air pollution kills more Africans than sanitation, poor sanitation and undernutrition? I mean, let that sink in. In Lagos City alone, air pollution contributes almost 60% of deaths of under 5s. So we just need to, a key part of awareness is really denormalizing these toxic systems and policies and actions that undermine the good work that is happening across civil society and even across in the healthcare sector. So that was a by the by. The three wishes I would like to focus on. The first is youth. And equipped youth in particular. So we have a median age of about 19, 20 in Africa. And we talk about youth as an untapped and critical dividend for the continent. But this promise can only be fulfilled if their future health is protected, and also if they're a meaningful part of designing the solutions. And in so doing, we see youth not just as the target group that benefits from interventions from their health, but also as the key agents for change. And this is the approach that we're taking in the Global Diet and Activity Research Group, GDAR, as we saw in the video at the beginning, where we consider, we've heard about health systems, we consider systems for health. So we talk about all the different systems in the urban context, so the built environment, the food environment, as we see these as systems for health. Transport is a system for health because the decisions we make in transport influence whether people are able to be physically active in a safe manner. So yes, behavior is important and choice is important. We talked about choice earlier, but in order to actually have the choice, we have to actually have access. So if we have environments that constrain choices, we cannot call behaviors true choices. So if we're going to create true choice, we have to increase the demand for healthy places. And I think equipped youth have the critical role to play. The second of the 3 points is integrated governance and foresight. So we see this, the lessons we've seen from COVID response. I've been working in urban health, looking at how to create health in human settlements and built environment from place for a while. And we've had such difficulty in bringing different sectors together. And by sectors, I mean not just public and private, but bringing the healthcare sector, the housing sector, the transport sector, the energy sector together, because the mandates are very separate. And yet, when we saw what we saw in the COVID response was this unprecedented collaboration, realizing that actually this is not a crisis for the healthcare sector, but this is a whole government, whole of society crisis that needs to be addressed in that manner. So we know that this is possible, and yet we constrain ourselves by this is how things are normally done. So my wish is that the lessons learned from how the COVID pandemic has been tackled around integrated governance and foresight, where we're thinking about health as a long-term goal across these different systems is critical. And key to that, when we talk about diabetes prevention and broader NCD prevention, is the need to embed that in the realities of urbanization, the realities of climate change, because these realities are determining how easy it is to eat healthy and to be physically active. And my final point, if I may, Mr. Moderator, is around leadership for urgent action. So what we've seen again from COVID wasn't, oh yes, we need to collaborate, but we need to first create this and think about it. And we saw urgent action. And just in an unprecedented way. NCDs, obviously, with diabetes, it's this slow motion, protracted emergency where we haven't seen sufficiently urgent and transformative action. We know from the data that is available that the rising burden of NCDs globally is really being driven primarily in low middle countries like across the African continent. We know that there is a rise in obesity, a rise in unhealthy eating. So we need leadership for urgent action. And that involves, and key ingredients of those are the intersectoral collaboration across those different sectors, the integrated governance, as I mentioned, and critically equipped youth. And I'll leave you with this thought. Early on the pandemic, I wrote a piece on why we need a Marshall Plan for urban health in Africa. And the reason I used the term Marshall Plan was that we need to think about addressing health, not as a healthcare issue, but as really a unique selling point and critical to sustainable development on the continent, and that we root all of our decisions around urban development, around how we, around economic recovery, really centered around health, so that we're not discounting people's future health because of issues that we need to address today, because that equation doesn't balance out. So really, building back better, I believe, needs visionary leadership and that unprecedented collaboration and a rethink of governance for health, like we've seen for COVID, engaging the youth very proactively for more transformative action for prevention. Thank you.
Thank you very much, Dr. Oni. And with this one, we come to the final discussions on the two panelists. And I think in summary, we have seen what is the WHO perspective. WHO perspective is taking care to the primary level. Then we have a community perspectives, whereby you have seen the example from Senegal, you have seen the example from Nigeria regarding the community interventions, the prevention interventions. At the same time, we also looked at the supply chain and the interruptions in the supply chain for a person living with type 1 diabetes, and what insulin supply chain interruption leads to, and what could be the major bottlenecks at different levels of care. And then finally, we have heard from Dr. Oni regarding the Marshall Plan for health for the African region, based on the three components, three pillars. One is the youth empowerment, integrated care approach, multi-sectoral approach, and mainly important, most important, is a very forceful leadership. So with this one, I think we have had a wonderful two panels, and I would like to thank all the speakers for the excellent moment. My apologies for cutting down you on your time, but we have a limited time, and I feel that we have learned a lot, and I'm sure if anyone has any questions, they can send it to the NCD Alliance, and this will be directed to individual panelists because we don't have much time, and they'll be directed to individual panelists for their responses. I would now like to invite Carl Mandlam, who is the Chief Operating Officer at the Ecobank Foundation, to wrap up the discussions.
Thank you very much. Mobilizing staff, communities, and partners to turn the tide on NCDs is possible when public, private, and civil society organizations come together. This is what our collaboration with the NCD Alliance is about. As Dr. Tolu said, prevention is everyone's business. Allow me to borrow from malaria prevention and remind all of us that zero diabetes starts with me, you, and all of us. George's experience highlighted the importance of local manufacturing for pharmaceutical and health products in Africa. Some of you may know, Africa imports $14 billion worth of pharmaceutical and health products a year. The WHO reminded us that decentralization of the state must be in line with health system to support communities' health, and in our case today, NCDs. Finally, we are grateful for the learning opportunity with partners. Together for Better Health is Ecobank's commitment to excellence in African transformation through health, specifically NCDs. So I want to wish you all a happy Ecobank Day 2020 and join the conversation online by visiting Ecobank's website and share your commitment. Thank you very much.
Enough NCDs. The best to ever do this, my voice elevating the voiceless, a name amongst the stars and galaxies, a wave beyond the seas. Let me speak, I say enough NCDs, enough, enough, enough NCDs, enough, enough, enough NCDs, enough, enough, enough NCDs, enough, enough. I say enough NCDs, let us be. Ever since you showed up, life turned crazy. Cigarette sticks so cheap, targets the poor, alcohol joints in every corner and more. I hold my head and ask, what are we waiting for? The NCD Alliance is reaching out to all. I write this message, send it out to the president, politician, every citizen that's resident, a people-centered health service that less the burden. Put a stop to NCDs flooding in. I say enough NCDs, enough, enough, 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 enough NCDs, enough, enough.